Welcome to today's lecture on idiopathic pulmonary fibrosis, IPF. In this comprehensive overview, we will delve into the cellular and molecular aspects, histopathological features, genetic factors, radiological evaluation, pulmonary function tests, management strategies, acute exacerbations, palliative care, prognostic factors, associated comorbidities, emerging therapies, and translational research related to IPF. IPF is a condition where lung tissue scars, causing fibrosis. Factors like faulty wound healing, chronic inflammation, and genetics contribute. Signaling pathways involving TGF-beta, EMT, and fibroblast activation are important for understanding IPF and developing treatments. Diagnostic lung biopsies provide valuable insights into the histopathological features of IPF. The hallmark histological patterns seen in IPF include usual interstitial pneumonia, UIP, and fibroblastic foci. UIP pattern exhibits heterogeneous fibrosis with areas of normal lung parenchyma, honeycombing, and inflammatory infiltrates. Fibroblastic foci represent activated fibroblasts that drive the formation of fibrotic lesions. Understanding these histopathological characteristics aids in accurate diagnosis and differentiation from other interstitial lung diseases. IPF has a strong genetic component, with various mutations identified in genes associated with surfactant protein metabolism, SFTPC and SFPA2, telomere maintenance, TERT and TERK, and components of the extracellular matrix, MUC5B. These mutations influence disease susceptibility, penetrance, and progression. Familial clustering of IPF cases also suggests inherited risk factors. Deciphering the genetic underpinnings of IPF enhances our understanding of disease heterogeneity and guides genetic counseling. High-resolution computed tomography, HRCT, scans play a crucial role in the diagnosis and monitoring of IPF. Radiological findings characteristic of IPF include reticular opacities, honeycombing, traction bronchiectasis, and architectural distortion. HRCT pattern classification, such as the UIP pattern, helps differentiate IPF from other interstitial lung diseases. Accurate interpretation of HRCT scans enables early detection, disease staging, and evaluation of treatment response in IPF patients. Pulmonary function tests, PFTs, are essential for evaluating lung function and monitoring disease progression in IPF. Parameters such as forced vital capacity, FVC, diffusing capacity of the lung for carbon monoxide, DLCO, and the ratio of forced expiratory volume in 1 second to forced vital capacity, FEV1/FVC, provide valuable information about lung volumes, gas diffusion capacity, and airflow limitation. Regular assessment of PFTs aids in determining disease severity, prognosis, and treatment response in IPF patients. The management of IPF involves a multidisciplinary approach aimed at symptom control, slowing disease progression, and improving quality of life. Current treatment options include antifibrotic agents, pirfenidone and nintedanib, that target profibrotic pathways. Supplemental oxygen, pulmonary rehabilitation, and vaccination strategies also play significant roles in IPF management. Exciting future perspectives involve the development of novel therapeutic targets, including tyrosine kinase inhibitors and immunomodulatory agents. Acute exacerbations significantly impact the prognosis of IPF patients. These events are characterized by rapid deterioration of respiratory function and are often triggered by infections, aspiration, or unknown factors. Early recognition, prompt initiation of supportive care, including supplemental oxygen and corticosteroids, and cautious use of immunomodulating agents are crucial for improving outcomes. Identifying risk factors, understanding the underlying pathogenesis, and developing targeted therapies are essential for preventing and managing acute exacerbations effectively. Palliative care plays a vital role in the comprehensive management of IPF. It focuses on relieving symptoms, improving psychological well-being, and enhancing overall quality of life. A multidisciplinary approach involving healthcare professionals, social workers, and psychologists ensures the provision of holistic care. Symptom management, advanced care planning, and psychosocial support are essential components of palliative care in IPF. Predicting disease progression and survival in IPF is challenging but crucial for treatment decisions. Prognostic factors such as age, gender, disease severity, FVC decline, DLCO values, radiological extent of fibrosis, and acute exacerbation history aid in risk stratification and prognosis estimation. Several prognostic scoring systems, including the GAP, Gender, Age, Physiology, CPI, Composite Physiologic Index, and ILD-GAP, Interstitial Lung Disease GAP, provide valuable tools for clinical decision-making and patient counseling. IPF often coexists with various comorbidities, which contribute to disease burden and impact outcomes. gastroesophageal reflux disease, GERD, obstructive sleep apnea, OSA, pulmonary hypertension, PH, coronary artery disease, CAD, and lung cancer are among the frequently observed comorbidities. Exploring the pathophysiological connections, shared risk factors, and optimal management strategies for these conditions is essential in the comprehensive care of IPF patients. Significant advancements have been made in understanding the pathophysiology of IPF, leading to the development of promising targeted therapies. Therapies targeting profibrotic pathways, such as PDGF, LOXL2, and CCN2 inhibitors, show potential in preclinical and clinical studies. Stem cell-based therapies, immune-modulating agents, and autotaxin inhibitors are also being explored as potential treatment options. Ongoing clinical trials hold promise for the future management of IPF. Translational research bridges the gap between basic science discoveries and clinical applications. In IPF, translational research aims to unravel the underlying disease mechanisms, identify novel biomarkers for early diagnosis and prognosis, and develop targeted interventions. Advanced techniques, including genomics, proteomics, and single-cell sequencing, provide valuable insights into disease pathogenesis. Collaborative efforts between scientists, clinicians, and industry partners are essential to facilitate the translation of research findings into clinical practice. In conclusion, idiopathic pulmonary fibrosis, IPF, is a complex disease that requires a comprehensive understanding of various aspects including genetics, imaging techniques, pulmonary function tests, and management strategies. This knowledge is crucial for improved diagnosis, treatment, and patient care to enhance outcomes and quality of life.